Hello guys, this is Dux Academy. Welcome to our YouTube channel. Today I'm going to explain the basic concepts of acetaminophen, also called paracetamol, which is the most common over-the-counter and prescribed medications for pain management. So, by this video, we are going to see the introduction part, the pharmacokinetics, the pharmacodynamics, and side effects, toxicity, and toxicity management of acetaminophen. Introduction. Acetaminophen, also called paracetamol, is a component of hundreds of over-the-counter and prescription medications used worldwide, categorized under non-opioid analgesics. Now let's see the pharmacokinetics. Absorption. Oral route. Paracetamol is well absorbed from the gastrointestinal tract or GI tract. When taken orally, peak plasma concentrations are typically reached within 30 to 60 minutes. However, due to the first pass metabolism in the liver, the actual bioavailability can vary between 63 and 89%. All rectal routes, as you know, rectal route is prescribed in patients with infants and neonates. So this method exhibits highly variable absorption with bioavailability ranging from 24 to 98, 98%, making its onset and duration of action less predictable. Intravenous administration. When given intravenously, paracetamol bypasses the GI tract absorption entirely, with effects starting within about 5 minutes and peak levels reached in 40 to 60 minutes. This route is especially useful when rapid action is required or when the internal administration isn't possible. Distribution. After absorption, paracetamol distributes widely throughout body tissues. Its water solubility allows it to cross the blood-brain barrier, which contributes to its central analgesic effects. At therapeutic doses, only a small fraction binds to plasma proteins, ensuring broad tissue penetrations. Metabolism. Primary pathway, minor pathway, we'll see these pathways. On primary pathway in the liver, about 90 to 95% of paracetamol undergoes conjugation with glucuronide and sulfates, forming mostly inactive metabolites that are safe and readily eliminated. These processes are undergone in the liver. Minor pathways, there are also minor pathways. Approximately 5 to 10% is metabolized via the cytochrome P450 system, especially cytochrome P2A1 to form N-acetyl P-benzoquinone imine or NAPQ, reactive intermediate, which is a reactive intermediate. Under normal conditions, NAPQ is detoxified by binding to glutathione. As you know, it is scavenger, glutathione is a scavenger. uh, Elimination. Both paracetamol and its conjugated metabolites are primarily excreted in the urine. So it is kidney elimination is based on the kidney or the renal system. Under normal dosing conditions, the elimination half-life is about 2 to 3 hours. So this can be prolonged in case of overdose or liver impairments. Now let's see the pharmacodynamics, the mechanism of action of paracetamol or acetaminophen, how it changes our body systems or how it brings an effect. The first one is analgesic effects. Central mechanisms. Paracetamol exact mechanism of action is not entirely understood. It is thought to act in the central nervous system by inhibiting cyclooxygenase or COX enzymes, possibly a variant such as COX-3, thereby reducing prostaglandin synthesis. As you know, prostaglandin is the main intermediate or the main cytokine for the production of heat and pain. You know, fever and pain are mediated by prostaglandin. So, COX-3, as COX-3 is inhibited, prostaglandin synthesis will be inhibited, and this is their mechanism. This inhibition plays a key role in its pain relieving properties. Additional pathways. Other proposed mechanisms include modulation of serotonergic pathways, an effect on the nitric oxide synthesis, and interactions with the endocannabinoid system. These diverse actions help explain its efficacy in providing analgesia without producing the pronounced anti-inflammatory effects seen in with non-steroidal anti-inflammatory drugs or NSAIDs. The second one is antipyretic effects, hypothalamic action. Paracetamol lowers fever primarily through its action on the hypothalamus, the body's temperature regulating center. By modulating prostaglandin activity in this region, it promotes heat dissipation via vasodilation and sweating, leading to a reduction in body temperatures. Despite its widespread use as analgesic and antipyretic, paracetamol lacks significant peripheral anti-inflammatory properties, which distinguish it from non-steroidal anti-inflammatory drugs. We have said that paracetamol is central, its mechanism is central or in the CNS because it is uh, lipid soluble and it can pass the brain barrier and it can act in the central nervous system. Welcome back, guys. Let's see side effects, toxicity, and management. Side effects, these are unwanted drug effects at the therapeutic doses. General tolerance, when used within recommended doses, paracetamol is usually very well tolerated. Common adverse reactions, some individuals might experience minor GI discomfort or allergic skin reactions such as rash, though these events are rare compared to those seen with other analgesics. Toxicity, the hepatotoxic risk, mechanism of toxicity, the predominant risk with paracetamol is hepatotoxicity. In cases of overdose, the normal conjugation pathways become saturated, leading to increased metabolism via the cytochrome P450 system. This results excessive production of NAPQ. When the liver glutathione stores are depleted, NAPQ accumulates, binds to cellular proteins, causes hepatocellular injury and necrosis, which results permanent hepatic failure in some cases. Clinical presentation, early signs of toxicity include nausea, vomiting, abdominal pain, particularly in the right upper quadrant. As liver damage advances, patients may develop jaundice, coagulopathy, and in severe cases, acute liver failure may occur. So, how to manage patients present with signs and symptoms of paracetamol toxicity or overdose? There is an antidote which is called N-acetylcysteine or NAC. NAC works by replenishing hepatic glutathione levels, thereby allowing detoxification detoxification of NAPQ. It also serves as an antioxidant to counteract oxidative damage within hepatocytes. Timing, its efficacy is highest when administered within 8 hours post-injection, though benefits may still be observed if treatment is initiated later. In addition to the antidotes or the main treatments, there is also supportive care given for patients with paracetamol toxicity. Besides NAC or N-acetylcysteine management includes supportive measures like intravenous fluids, correction of electrolyte imbalances, and monitoring of signs of liver failure, so like AST, ALT, or other synthetic and secretory functions of the liver should be assessed or should be measured. In case of permanent hepatic failure, a liver transplant may be necessary.